Hey everyone, it's Sarah with registerednursern.com, and in this video I'm going to be going over an NCLEX review of heart failure. This video is part of an NCLEX series over the cardiovascular system, and in this specific video, it's going to be part one. I'm going to be covering the pathophysiology of heart failure, the causes, the signs and symptoms, the different types, what triggers it, how it's diagnosed, and things like that. And I'm going to be giving you some clever mnemonics on how to remember this material for NCLEX and your nursing lecture exams. And in the next video, which will be part two, I'm going to be covering specifically the nursing interventions and the pharmacological aspect of heart failure, which is another important part that NCLEX will test you on. And then after you watch this video, be sure to go to my website, registerednursern.com, and take the free NCLEX quiz that will test you on this material. And a card should be popping up so you can access that. So let's get started. First, let's start out talking about what is heart failure. Heart failure is where the heart is too weak to pump efficiently. And because it can't pump efficiently, what happens? It can't provide the proper cardiac output that your body needs to maintain its metabolic needs. So what's really happening with heart failure is that heart muscle has either messed up with how it can contract and pump that blood up through those valves, out through your heart, out through the other side of the heart, or it's become too stiff. And we're mainly talking about the ventricles of the heart. We're going to be talking about mainly our right ventricle and our left ventricle, and I'll go over that in depth whenever we cover the different types. Now, what are the causes of heart failure? To help you remember this, remember the mnemonic failure. We're talking about heart failure, so it's easy to remember failure whenever we're trying to think about what causes this condition. So first, F, faulty heart valves. What does this mean? Well, you have 4 different valves in your heart. You have your tricuspid and your bicuspid valve, also called your mitral valve, which are your avioventricular valves. And then you have your pulmonic valve and your aortic valve, which are your semilunar valves. Now, your tricuspid valve and your bicuspid valve can become stenosed, or it can become regurgitated. And whenever it becomes stenosed, it's too narrow, and whenever it becomes regurgitated, it means it leaks. And this can lead to heart failure. I have seen this as a nurse in the clinical setting. Patient comes in, they have messed up heart valves, maybe from endocarditis, and they need their heart valves replaced, because whenever those heart valves are messed up, it causes your heart to overwork and they enter into heart failure. But whenever they get those valves replaced, it fixes the problem and they're much better. Okay, next, A, arrhythmias. Arrhythmias like atrial fibrillation or tachycardia can send you into heart failure. And this is where, for instance, let's talk about atrial fibrillation. Atrial fibrillation is where your atriums are quivering. They're not pumping efficiently, so blood is like pooling in there. And this can send a patient into heart failure. A lot of times I have seen patients come in, they didn't even know they were in AFib, and they had the signs of heart failure. And also tachycardia. This is where you have a really fast heart rate. Patient may not know it. It's elevated for a long time. That puts a lot of strain on that heart, makes that muscle weak, and they enter into heart failure. I, infarction, such as myocardial infarction, and you will get this with coronary artery disease. Myocardial infarction, heart attack, what happens is that they have a plaque buildup in one of those arteries that feeds that heart muscle, all that nutrients, it blocks all that nutrients go into that heart muscle becomes ischemic and dies, and it becomes weak. So for instance, like left ventricle, this happens a lot whenever people get left-sided heart failure. The arteries that feed that ventricle become blocked, that muscle dies, sends them into heart failure. L for lineage. This is genetic, family history. Mom, dad, grandmother had it, so you're more at risk for developing it. Congenital, you're born with it. Family history, so that can run in families. Next, U, uncontrolled hypertension. We talked about in the NCLEX review video of hypertension. Hypertension is number one, it's a silent killer because patients don't know that they have it. They don't have signs and symptoms until it's too late, till it's affected the organs. And what happens is whenever you have such that high pressure beating on that heart, it can cause those ventricles to become stiffened. So whenever they become stiffened, those ventricles will not fill properly with blood, and you can enter into heart failure. R, recreational drug use, such as cocaine or alcohol abuse. Patients who do cocaine or have alcohol abuse are more susceptible for developing heart failure. E, evaders, such as viruses, infections that get in and attack the heart. I have seen this again. A patient will come in, they're relatively healthy, some of them are young, but they've got some type of virus or infection that has attacked that heart muscle, made it weak, and now they are in heart failure. Now let's look at the different types of heart failure you can have. You can have left or right-sided or both. Now to help you understand the different types of heart failure, because this is a big thing that NCLEX likes to ask, and especially your nursing lecture exams, because you need to know those different signs and symptoms that a patient with left-sided heart failure may be presenting with that someone with right-sided may. So you need to know the different ones. And let's look at the blood flow, how the blood flow flows through the heart, and the pathophysiology of it. Okay, first let's get familiar with which side of the heart is which, because that is very important when determining if you're in left-sided or right-sided heart failure. So this right here is the right side of the heart, where the blue unoxygenated blood is draining down into the heart. This side is the left side of the heart, where the nice, rich, red oxygenated blood, it's went through the lungs, is going to be pumped up through the body. And we're specifically, remember, looking at these ventricles, because that's where our problem is with heart failure. They're either too stiff or they're not contracting properly. So first let's look at how the blood normally flows through the heart, and then we'll go through how it can back up and cause all those signs and symptoms. Okay, so you have your superior vena cava and you have your inferior vena cava, and what these do is they drain all that blood that your body has used to become reoxygenated. It wants to send it through the lungs. That's the goal of your right side, to get that blood to the lungs to become oxygenated so it can go back to your body. So it does that. Now note, this is important later. In your inferior vena cava, it's also connected through those hepatic veins to the liver. So whenever you start getting congestion in your right side of the heart, the liver is going to be affected, which we'll go over here in a second. So it drains down into your right atrium. Then it flows down through the tricuspid valve, then to your right ventricle. The right ventricle squeezes it up through your pulmonic valve, up through your pulmonary artery, and out through your lungs. And then it goes through gas exchange through those little sacs. It becomes replenished. Then it's nice and oxygenated, and it shoots through the heart, down through the left atrium, down through the bicuspid valve, which is also called your mitral valve, then down into that left ventricle. And remember, the left ventricle has the most pumping power of all four chambers, because it has to, in order to shoot that blood up through the body. So that left ventricle will squeeze that blood, shoot it up through your aortic valve, up through your aorta, and then through your whole body, and then the cycle starts all over again. Now, with heart failure, like I've said, there's either a contraction problem with these ventricles, they're not contracting properly, maybe the muscles died, become ischemic, or they're not filling properly, and this could be due to uncontrolled hypertension, where that ventricle has just become too stiff. First, let's talk about left-sided heart failure. So what's happening in left-sided heart failure? Why do you get pulmonary symptoms? Well, with left-sided heart failure, the ventricle, either it's too stiff or it's not contracting properly. And you can have diastolic or systolic left ventricle dysfunction, which we'll go over here in a second. And what happens is that the blood will backflow up through your atrium and up into your lungs. So the patient will start presenting with pulmonary symptoms because that blood is backflowing into there. So they may have crackles, shortness of breath, orthopnea, where they can't even lay down and sleep. So they're going to get pulmonary signs and symptoms with left-sided heart failure. Now, with right-sided. As a side note, remember this, left-sided, because it's over here, it can increase the pressure in the right ventricle because of all this backflowing of blood up through here, and it can actually cause a patient to go into right-sided heart failure as well. So remember that. So you can have both going on at the same time. But sometimes you can just have right-sided heart failure. And whenever that happens on your right side, watch where the blood would backflow. Where you have too much blood backflowing because your ventricles aren't pumping out properly, where's that blood going to go? It's going to go up into those superior and inferior vena cavas out through the peripheral areas. So you're going to be seeing peripheral edema, excessive weight gain. They may have increased abdominal girth in their belly ascites. And again, back to the hepatic veins, because all this blood is going to congest into the inferior vena cava. It's going to cause hepatomegaly and cause your liver to become enlarged, and then you'll get the large abdomen and just really uncomfortable. So that is why you would see the certain signs and symptoms with each side. So again, just to recap, your left side, you are going to see pulmonary issues because it's backflowing into your lungs. On the right side, you're going to see peripheral edema and issues like that. Okay, as I was talking about before, you can have left-sided systolic dysfunction, or you can have left-sided diastolic dysfunction, and we're talking about the left side of the heart, the left ventricle. So let's go over systolic. You can also see it as left ventricular systolic dysfunction. Okay, now let's think about what systolic is. We talked about this in the other video where we went in depth about blood flow. What is systolic? Systolic is the squeezing phase of your heart. Remember, S, systolic, squeezing. So it's the contracting phase of your heart. So there is an issue with the left ventricle contracting and squeezing that blood up through the heart. Now, with this, patients are going to have a low ejection fraction, usually less than 40%. A less than 40% ejection fraction is a diagnosis for heart failure. And whenever that happens, the heart cannot squeeze that nice, fresh, oxygenated blood up through all those tissues, everything that needs it, those vital organs, so they don't get it, and it backs up into the lungs, as you just seen. Now, what is ejection fraction? What does it mean? It's a calculation tool that is used to diagnose the contracting ability of your left ventricle. So, it's the amount of blood that fills inside the left ventricle that is actually being contracted out of that ventricle. Now, for instance, say that you've seen that a patient had an echo-cardiogram, because that's one of the tools used to diagnose ejection fraction, and it said an EF of 38%. What does that mean? That means that only 38% of the blood that filled inside the left ventricle is being pumped out. That is bad. So they are in heart failure. Now, a normal EF is an ejection fraction of greater than 50%. That's a normal, healthy heart. And like I said, it can be diagnosed with an echocardiogram. Remember this. This is really important not only for NCLEX, but whenever you work as a nurse, whenever you're reading test results. So an echocardiogram can give you an ejection fraction. A heart catheterization can give you an ejection fraction. And a nuclear stress test can as well give you that. Now let's look at left-sided diastolic dysfunction. We just looked at systolic, and that was the squeezing part of the heart. There was an issue with the left ventricle being able to squeeze properly. With diastolic dysfunction, it is an issue with the ventricle being able to fill properly, because the diastole is the filling / resting phase of the heart. So the ventricle, this left ventricle, has probably become too stiff to fill with blood. So not all the blood that's supposed to get in there gets in there, but it contracts normally. So it gets just a little bit of blood and it contracts beautifully. So because it's not an issue with contraction, it's an issue with it actually filling, your ejection fraction is usually going to be normal on these patients. So they'll go for an echocardiogram and their EF comes back normal, because there's not an issue with contraction, just filling. Now, with your left-sided heart failure, just because of where that left ventricle is, you are going to have pulmonary symptoms with your left-sided heart failures. Now let's look at right-sided, the other type of heart failure. Right-sided heart failure is not as common as left-sided heart failure. Funny enough, left-sided heart failure is one of the main causes of why people would enter into right-sided heart failure. Along with, it's also caused by a pulmonary heart disease called cor pulmonale. As a complication of the patient either has pulmonary hypertension or COPD, so that can be other causes of it. Now, just to recap, with the right-sided, remember, on the right ventricle, just where it's located and where the anatomy is and everything that's going to be affected, it just makes sense if this ventricle is not contracting properly, blood is backflowing, it's going to go peripherally. So you're going to see peripheral signs and symptoms with this. With left-sided, you're going to see pulmonary. So now let's look at the signs and symptoms side by side, and let me give you some clever mnemonics on how to remember them. Okay, for right-sided heart failure, let's remember the mnemonic swelling. And why swelling? Because remember, these patients are going to have peripheral swelling everywhere. So it's just an easy mnemonic to help you remember the typical signs and symptoms. And then for left-sided heart failure, we're going to remember the word drowning. Because remember, our lungs, the pulmonary system, is majorly involved in this. And they are literally drowning in their own fluid. So let's remember the word drowning. Okay, so let's start with right-sided. For the S, in swelling, we're going to remember swelling of the hands, the legs, the liver. They're going to have a lot of congestion, a lot of fluid going on with that. W, weight gain. This is going to be present with both of them, but especially with right-sided heart failure. You want to tell the patients to monitor their weights daily. Any fluctuation between 2 to 3 pounds in one day or 5 pounds in a week is something to be alarmed about because they could be going into heart failure exacerbation. Edema. These patients not only will have swelling, but they could have pitting edema in their legs. And this is where you can press on the tibia of the leg and it will actually pit in. I have seen 3, 4 plus pitting edema. It's very, very interesting how much swelling these patients can have. L for large neck veins. This is the jugular veins. I have a video on how to do this, but if you turn the patient's neck to the right side, they're setting up, or laying back a little bit, you can actually see jugular venous distension. L for lethargic. These patients are going to be extremely tired, they can't tolerate, it's hard for them to even get up from the bed to the bedside chair. They get very winded because of all this extra fluid they're carrying, and their heart is just so weak it can't pump efficiently to get that blood going everywhere. I for irregular heart rate. A lot of times whenever patients come in with congestive heart failure, they can flip into irregular heart rate like atrial fibrillation. Another thing is nocturia, the N, and this is very interesting. This is where they have all of a sudden frequent urination in the middle of the night, at the time they don't want to have it. And this is because normally people are up moving around, but at night whenever you're laying down, your legs are elevated, it allows that fluid to enter back into the vascular system, goes to the kidneys, so your kidneys try to start putting out that fluid. So that's why they may have excessive urination at night with this. And G for girth, the abdominal girth of their belly can be increased, and this is because, remember, of the hepatomegaly, where all this congested fluid is going to the liver. So they can have that. Whenever they have they have this big belly of extra fluid. It can cause them not to breathe very well. They'll have difficulty breathing because it's pushing on those lungs. It's also going to be pushing on the stomach, so they could have anorexia, just don't feel like eating, and they can feel nauseous with this. Now, left-sided heart failure, we're drowning because we got pulmonary issues going on. First, D, remember dyspnea. This is because of all that fluid backing up into that lungs, causing that patient not to breathe very well. R for rales. This is another word for crackles. This is when you listen with your stethoscope and you can hear in the lungs this crackling noise. How I like to do is take your hair and take it by your ear, and that's what it sounds like. O for orthopnea. This is one of the telltale signs if a patient tells you and they have a history of congestive heart failure, at night I've been having to use some pillows to set up to sleep and breathe because I just can't breathe. That is a warning sign that they may be going into heart failure exacerbation. So that's what that is. And then W for weakness, again, just like with right-sided heart failure, they're going to be extremely weak just because that heart cannot put out the cardiac output it needs to meet your body's metabolic needs. N for nocturnal proximal dyspnea. This is where at night they will just wake up all of a sudden with extreme breathing difficulty. You just can't breathe at all. It's very frightening for them. And this is one of the things that can happen with left-sided heart failure because you're having those pulmonary issues. I for increased heart rate, and the reason they have increased heart rate is because they have the body senses, hey, we have all this blood in the heart, but we need to get out to the organs, so it's just staying there. So that heart will increase that heart rate and make it become tacky so it can pump it out to get to those vital organs. N for nagging cough. Again, you have the lung issues going on, they'll have this persistent nagging cough, and sometimes it can become frothy or blood-tinged sputum. And if this happens, this is a really, really bad sign that something horrible is going on and you need to get them diuresed fast because they have some major fluid overload. So if you see that, that's usually a late sign. G for gaining weight, again, just with right-sided heart failure. If they gain more than 2 to 3 pounds in a day or 5 pounds in a week, that is a red flag. Okay, let's look at real fast how heart failure is diagnosed in the hospital setting. Okay, a lot of times physicians will order a lab result called a BNP. It stands for B-type natriuretic peptide. We call it BNP. And what it is, it's a biomarker that's released by your ventricle when there's excessive pressure on the heart due to heart failure. And typical readings, if you have less than 100, there's no heart failure going on. If you have 100 to 300 reading, it's present. Greater than 300, it's mild. Greater than 600, it's moderate. And greater than 900, it's severe. And I have seen these in the 2000s with heart failure patients. Other things that are used to diagnose this, a chest x-ray, looking to see if there's any congestion in those lungs, looking at the heart to see if it's enlarged, an echo-cardiogram, a heart cath, and a nuclear stress test, which is what we talked about earlier with ejection fraction. Now, heart failure can be maintained for patients. They can take medications, they can do diet regimen, and other treatments, so they can maintain it. However, heart failure can go into exacerbation where it comes out in full force, and some things that can trigger that are maybe the patient isn't compliant with their diet, they eat a lot of fast food, a lot of sodium, they don't restrict their fluids, they drink a lot of soda, a lot of water. That can trigger them to go into heart failure. Infection, they get really sick, stresses the heart out, go into heart failure. Uncontrolled atrial fibrillation or renal failure, because renal patients have issues with fluid overload already, and that can put more stress on the heart that already is more susceptible to heart failure. So in the next video, be sure to check out part 2 because I'm going to be going over nursing interventions and all those medications to use to treat heart failure. So thank you so much for watching this video, and please consider subscribing to this YouTube channel.